Welcome. This video presents some of the current major medical ethics issues for medical doctors. The text was compiled by Dr. Sandy Sandbar with grateful help from Open Evidence. The video was developed by the computer scientist Tyler Sandbar and is narrated by artificial intelligence. This presentation day explores pressing medical ethics issues. The focus is on how law, politics, and science intersect in healthcare decisions. The topics covered include 1. Transgender youth healthcare, 2. Reproductive rights, 3. Marijuana use, 4. Organ donation, 5. Social media risks, 6. Reporting unethical behavior of healthcare providers, and 7. Other emerging issues. The first medical ethics issue is healthcare for transgender youth. 1. Among U.S. adults, 0.8%, which is over 2.1 million people, identify themselves as transgender. 2. Among youth aged 13 to 17 in the U.S., 3.3%, about 724,000 youth, identify as transgender. The criminalization of gender-affirming healthcare for transgender youth is a recent phenomenon driven by political and ideological forces, not by scientific or medical consensus. Major medical organizations, including the American Academy of Pediatrics and the American College of Physicians, recognize gender-affirming care, GAT, as medically necessary and evidence-based for youth experiencing gender dysphoria. Criminalization of gender-affirming care is driven by politics, not science, and gender-affirming care is recognized as medically necessary by leading organizations. It improves mental health and reduces suicide risk. So, what are the ethical and legal implications on transgender youth? 1. Legislation placing bans on transgender youth cause abrupt loss of care, family disruption, and threats to doctors and other healthcare providers. 2. Ethical principles such as autonomy, beneficence, and justice support continued access to treatment of transgender youth. Physicians must resist disinformation and advocate for patients. The next medical ethics issue is reproductive rights post-Roe v. Wade. The Dobbs v. Jackson decision that overturned the half-a-century precedent, Roe v. Wade, created a patchwork of laws. 1. As of 2025, 14 states ban abortion entirely. 2. Other states impose restrictions or protections. 3. The constitutionality of new state laws is being tested in courts with arguments focusing on equal protection, due process, and privacy. 4. The public health consequences are profound, including reduced access to comprehensive reproductive care, increased travel and financial burdens, and heightened risks for medically underserved groups. 5. And the medical community uses evidence-based reproductive health policies and support patients navigating these complex legal landscapes. What are the ethical and public health implications with respect to reproductive rights? These include 1. Restrictions on transgender youth criminalize providers and limit autonomy. 2. Marginalized groups are disproportionately harmed. And 3. Medical trainees face uncertainty about legal risks. Marijuana use challenges have become nationwide in the U.S. 1. Legalization of medical and recreational marijuana is expanding, but evidence remains limited. 2. Importantly, however, there are no FDA-approved uses for plant cannabis such as THC and CBD. The FDA has approved synthetic cannabinoids, such as Epidiolex. 3. Physicians must balance beneficence with non-maleficence when recommending cannabinoids. Please be mindful that there are some clinical and legal considerations when recommending marijuana, including the following. 1. Knowledge gaps and lack of dosing guidelines complicate care. 2. Shared decision-making and transparency are essential. 3. Physicians face liability risks amid cultural debates. The next major medical ethics issue is organ donation and xenotransplantation. 1. Organ shortages persist. 2. Xenotransplantation, such as pig organs, offers promise but raises ethical concerns, animal welfare, infection risk, and justice in trials. There are allocation and policy issues such as 1. Debates continue over HIV-positive donors and allocation fairness. 2. Evidence-based, transparent policies are needed. And 3. Public trust depends on ethical oversight. The next medical ethics issue is social media risks. 1. Social media offers education opportunities but carries risks. 2. Confidentiality breaches and misinformation are major concerns. And 3. Physicians face malpractice and liability exposure. A medical ethics area of concern pertains to professional standards online. 1. Institutions should set clear guidelines regarding medical information online. 2. Physicians should avoid endorsing unproven treatments. And 3. Healthcare providers should counter misinformation proactively while maintaining professional boundaries. An extremely important medical ethics issue is reporting unethical behavior, physical and mental disabilities that may adversely affect patient care. 1. Physicians are ethically and legally obligated to report unsafe colleagues, be it due to physical or mental disabilities, drug, alcohol, or other drug abuse, improprieties with patients, and disruptive behavior. 2. The AMA Code of Ethics mandates this. 3. The barriers to reporting unethical behavior include fear of retribution and lack of preparedness. To be sure, there are several additional medical ethics issues to keep in mind. For example, 1. Health disparities persist for LGBTQ+ marginalized groups. 2. Scientific disinformation undermines trust. And 3. Provider well-being is threatened by political and legal attacks. In conclusion, please remember that 1. Medicine, law, and ethics are increasingly intertwined. 2. Physicians must uphold autonomy, beneficence, and justice. And 3. Advocacy, education, and institutional support are essential to protect patients and the medical profession. Thank you for listening.